ask you to put your hands together for Sally Casswell. Kia ora.
Tēnā koutou katoa. Thank you to the organisers for inviting me to come. I appreciate it. So I came to Aotearoa from England, from the centre of England, in 1971. So I've lived most of my life in this wonderful country, and I think of it as a great privilege that I've been able to live here under Te Riti. So long may Te Riti continue, if not my life. So I'm very conscious of the fact that I come from a very different background, a very different context, and what I'm presenting today is different from what we've heard so far. So I have no lived experience. In fact, I have had very little involvement with FASD as a researcher, despite Christine Rogan's very best efforts over many years. I do want to acknowledge Rawiri and the treaty claim, and I listened to your evidence, Deb. I think that was, for me, a bit of a turning point in acknowledging and recognising the importance of this issue that we're talking about today. But what you'll see, I mean, as I listened to Rawiri's very powerful korero, what I thought was, well, what I'm going to get up and present is the exact example of what he is saying is a complete waste of time. I stand before you with a little bit of courage, and I want to say very strongly that I do think that the kind of work that we're presenting today is complementary to the work that you have heard about so far. So, and I hope that what I want to do, as well as presenting briefly the results of the research that we've done, is try to argue very strongly for a broadening of the perspective of the discussion around the ways to prevent FASD, because I think we need to look more broadly beyond the woman, the whānau. We need to look at the alcohol products and the way we in Aotearoa allow them to be sold and marketed. So, the research first. So this research, it's research about alcohol's harm to people other than the drinker themselves. And the reason we were so keen to do this is, I want to just say briefly what the global context is, and some of you will be very well aware of this, that regularly there are calculations made of the global burden of disease, and they compare things like tobacco, like alcohol, like pollution, like bad food, and so on. And the score that the risk factor gets does, to some extent, influence the way in which globally and then at the national level, priorities are assigned to how important these issues are. What we felt very strongly was that alcohol, because most of the data available is around what's happening to the drinker, cancer, heart disease, so on and so forth, but it's missing some of the material that we know is so important, the harm that is so important, which is beyond the drinker themselves. So we wanted to try and get some more information, and we're very privileged in Aotearoa. We have a very good database, bringing together data from hospitalisation, police, and so on. And I want to acknowledge that the World Health Organization's Global Alcohol Action Plan does mention FASD, but it's very minimal. And it's really saying, you know, member states, the countries that are part of the WHO, should raise awareness of the dangers of drinking in pregnancy. It doesn't make the link to these broader policy issues that I want to make a link to. I think there's a lot more that could be done in relation to what is happening at the global level. So this research is funded by the Health Research Council, and what we did was we quantified alcohol's harm to others in Aotearoa using something called DALYs, or Disability Adjusted Life Years. So this is just a measure which allows us to compare across a whole lot of different risk factors, and also in our case to compare between the harm that the drinker, him or herself, experiences and the harm that is experienced by others. So disability adjusted life years is a combination of mortality, the deaths which are attributable to the risk factor, and also the number of years lived with disability from this particular issue. And what we included in our study was traffic injury due to another's drinking, interpersonal violence, and FASD. We used estimates of the prevalence of FASD, which we had published, based on the New Zealand Health Survey data of drinking in pregnancy. And I heard a sort of intake of breath when Joanna mentioned it. I think that was our research, because the prevalence we estimated was much lower than, for example, on the Ministry of Health website. We estimated total prevalence of FASD to be about 1.3 from memory. Yes, 1.3%. So much lower than many of you in this room believe to be the case. We recognise that this is probably a very conservative estimate, but that, I think when you see the results I'm about to present, that makes them all the more powerful, because we may be underestimating the prevalence level out there. And the innovative thing we did was that, and when I say we, the wonderful Pepe Romeo, who's our statistician, did it all, not me. Don't ask me any details about what he did. Talk to him. But what he did, we had disability. So in order to create these DALY measures, you have to have disability weights. You have to have estimates of how bad the disability is that you live with. There were disability weights for FAS, but not for FASD. So by doing statistical assessment, we established, or we estimated, disability weights for FASD. So this is the first time it's ever been done, but there'll be lots of researchers coming after us who will critique what we've done and will do it better in the future. But at least this was a start. So these are the results in terms of the estimates we made for Aotearoa alcohol harm to others overall. So I was amazed when I saw these results. So you can see that of the total, 700, I've got terrible eyesight, 78,000 plus DALYs, disability adjusted life years, lost in Aotearoa, this is in 2018. You'll see that traffic injuries and interpersonal violence do contribute in a very small way, but the 90% of those DALYs are due to FASD, which really brings it home very strongly what an incredible negative contribution this is making to alcohol harm, to what people are experiencing in Aotearoa, and I'm sure in many countries around the world. And then what we were able to also do, other researchers had calculated DALYs for alcohol harm to the drinker in the same year, 2018. So we were able to make a comparison with the DALYs attributable to for the drinker, as I mentioned before, cancer, traffic crash, death from traffic crash and so on. But what we found was that this, according to the estimates we had made, alcohol harm to others was actually slightly greater in terms of the years of life lost. And this actually is in line with alcohol research work that's been done in Australia, where they've looked at economic costs and they've made very similar estimates that actually harm to others is a very, very major part of alcohol's harm. And I think this is very under-recognised in the policy debate in Aotearoa. So we've tried to get some interest in it. We wrote a piece for the conversation. We've put out media releases. We haven't seemed to engender much media interest, and I find that quite interesting, because these are really new data and I think very compelling data. So what I'll do in my last few minutes is argue for policy change. I think we can and need to argue strongly that FASD is likely to affect the overall levels of alcohol use in the community. We cannot see it as just something which the pregnant woman does in isolation from everyone else. We know that one of the strongest associations is with the drinking of the partner, but it's much broader than that as well. It's the whānau, it's the community, it's the whole of the society. What we see in Aotearoa at the moment is per capita consumption. We've got good data because we tax alcohol. It's fairly stable. It increased in the first decade of this century, and then it decreased in the second decade of this century. But we still see that, and there have been drops, and you will hear a lot of the talk about the decreases particularly from the vested interests, from the commercial interests, that there have been drops in hazardous and heavy episodic drinking. Heavy episodic drinking is drinking 60 grams or more at least once a month, and that equates to about 5 of our RTDs in one drinking occasion. So I was going to say by some New Zealand standards, not a very high level, but there's a combination of reasons, and I'm not going to try and go through them today, but I do think it's worth noting that just very recently, our affordability of alcohol has been quite low, and that's, I think, to do with the cost of living crisis, and I think that's why we've seen some of the changes that we've seen. So we always have to be mindful that this is not a definite trend that we've seen at this stage. It may well change in better economic times. And the other point to make is that we are still seeing high levels of relatively heavy use. So 1 in 5 women drinkers of childbearing age were heavy episodic drinkers in 2022 and 2023. And I just want to mention in passing, we talked about this in the conversation piece if you're interested in finding out more, but we did refer back to a study we did in 2011 because, of course, some of these are now the mothers, the biological mothers of the people with FASD. And we did see a small proportion in that population of very, very heavy young women drinkers. They were drinking twice the average adult level. They were unhappy, their life satisfaction was very low, they were dependent. They were RTD drinkers and spirits drinkers. They bought mainly from takeaway. They bought late at night. They liked alcohol marketing. They liked the advertising. Just to give you a sense of a bit of a constellation of that group of people. So my argument here is that the status quo in Aotearoa around alcohol consumption across the whole population, it will result in ongoing harm in terms of FASD as well as other harms. And, sorry, my old-fashioned way. So I'm going to argue that while these are important and they will continue to happen, we will continue to do information campaigns. We will continue, and we have in Aotearoa, to argue for warning labels on products. These are going to have limited impacts overall. The evidence shows that these will have limited impacts overall. I do want to just mention in passing that there is one piece of research about what's happened in the US over a period of time, those states that have put in place mandating the requirement for outlets to have warning labels, and that has shown some impact, some decrease in premature birth and very low birth weight, which makes you think that it might be useful for FASD. So just reminding you about the petition that was mentioned earlier. I'll certainly go out and sign it. But I think we can't rely on these kind of efforts to persuade women. There is some evidence that if women are drinking heavily, and brief intervention is when they're screened, there's a question asked about drinking, and then there's help given if necessary. There is some evidence that that helps, which leads you to the idea that workforce development around this issue is very important, which we've already heard about several times this morning. And of course, the evidence would suggest huge importance of holistic and supportive policies around women, not the sort of punitive policies which we see being put in place in the US, for example, at the moment. And of course, they're often community-led, often Māori-led, by Māori for Māori. But I'm going to say strongly that I don't think we can rely on addressing FASD independent of like these focus on women, independent of looking at the community-wide behaviours, and that in order to do that, we do need better control on the sale and marketing of alcohol products. So we've got something to celebrate recently, which is the alcohol local policy for Tamaki Makaurau, and thank goodness that has finally gone through. And as you all know, it's reducing trading hours, it's potentially reducing availability density in some key areas. The extent to which this is now going to be undermined by the popularity of online purchase and home delivery remains yet to be seen, and that's something we have to be very aware of. But it is really important. The more deprived areas in Aotearoa have more alcohol outlets, and this is completely and utterly unethical. So to finally say the policy changes we need, I think it's important to continue to focus on the affordability of alcohol, and the key way to change affordability is to increase taxes, and this of course does give government more money, which if they then chose to put it towards helping people with FASD would be a very good thing. But as I said before, you know, we've also got to think about online delivery, online purchase and home delivery. And finally, I think it is absolutely crucial we continue to pick up on this issue of marketing. We have tried so many times, we've had so many recommendations from ministerial committees, from the Royal, you know, from the Law Commission, all saying, yes, Aotearoa's population wants restrictions on alcohol marketing. We need comprehensive restrictions on alcohol marketing. How can you ask pregnant women not to drink when they are being exposed in every aspect of their lives to these kinds of messages, which only portray a positive view and none of the harms? So I think that remains, for me, a very, very major policy need. So finally, thank you very much for listening. That's where I come from, and very good to have had the opportunity to talk to you. Thank you.